how people are brought into the world and how they're like told their birth story matters. And I think that it really sets out the trajectory of the rest of their life.
Welcome back to the Midwifery Wisdom Podcast. This week we have an episode that both midwives and parents are going to enjoy. Augustine is joined by midwife Sophia Henderson and chiropractor Jen Santos. Jen has emphasized her career in working specifically with pregnant moms and brand new babies. In this episode, they dive into what exactly chiropractic care for newborns really looks like, some of the logistics of chiropractic care, fascia, nerves, etc. And we even get some real incredible stories of how impactful chiropractic care has been for babies. Jen shares a bit about her incredible model that allows chiropractic care to be more accessible for the families in her area as well, and how midwives can effectively build relationships with chiropractors in their area to be able to apply this incredible tool for their clients as well. Without further ado, let's jump into this conversation.
Well, welcome to the podcast.
Thank you.
So excited to have you here.
I know.
I know we've got so much to talk about, right? Gosh, Sophia sort of primed the pump here with like what we're going to talk about. I'm so excited. Dr. Jen, welcome. And let's start with introductions, right? So Sophia, why don't you take us away and tell us who you are, what you are, what you do, where you are, all those things, and then introduce your guest who you brought on the call. How about that?
Sounds good. My name is Sophia Henderson. I'm a licensed midwife in California in the North Bay, and I'm a mom of two. One was born at home and the other was born by C-section, and they are both NICU babies, and their beginnings opened my eyes to what chiropractic care can really do for babies. I had no clue before that, and so they're both healthy and happy children. And so I really feel like their journey led me to this point where now I utilize chiropractic care for our families, and it's made a world of difference for people. And I guess, yes, my guest is Dr. Jen Santos, who we are so blessed to have in our community. And we just keep begging her to open more and more chiropractic offices in surrounding counties, or so that more families can have the joy of working with her team.
That's awesome. Well, Dr. Jen, let's go to you. Tell us, how you got into chiropractic. We know where you are in the world, and then you have a specialty, right? So drop us into this specialty.
Yeah, I actually grew up in the chiropractic world. My dad is a chiropractor, so I'm what we call a second generation chiropractor. I homeschooled in the back of the office, and so I got to see the miracles of chiropractic all the time. And it wasn't until I got into high school, or I think college, that I realized not every person was under chiropractic care, regardless of the presence or absence of symptoms, but just like for vitality of life. And so that kind of like was like, oh, that's weird. Why would anybody want to go through life not seeing a chiropractor? And it was really a paradigm shift for me. So a lot of chiropractors get into chiropractic because chiropractic helped them, or there was a specific injury. For me, it was so the opposite, where it was like I grew up with it and didn't realize how weird the world is outside of chiropractic. And then my specialty, I'm a little bit of a, I don't know, rebel or renegade or whatever you want to call me, but I've always looked at like, okay, this is how things work, but what about when they don't work well, right? This is how it's supposed to work, but let's take it apart and look at everything and figure out how all the ways that it could break down. And so going through chiropractic college, I'm all about like wellness and vitality. And I was really into the pathology. I really wanted to understand the pathophysiology and how things worked and what happened when they didn't work properly. And that kind of really led me into the world of prenatal and pediatric care, because my thought was, what's the best time to take care of somebody and set them up, for this optimal expression of life. And it was like, okay, well, when you're pregnant, pregnant women should be adjusted. And then it was like, well, yeah, but if we are adjusting the pregnant person, then we're allowing for the pelvis to, be in alignment. And it's what I affectionately call like creating a luxury pelvis for baby to grow in. We're creating that space and that luxury pelvis for baby to grow in. And then it's like, well, not that we're adjusting the baby, but we're creating that environment for the baby to grow. And then it's like, well, if we do that, then really we should be preparing the pregnant person before they are pregnant. So preconception work. And so it just kind of got me into that world. And I've been doing that ever since. So it was sort of the joke in chiropractic college where we would be in, some class, I don't even remember, cardiophysiology, pulmonary physiology, I don't know, whatever. And we'd be in some class and they'd be, the teacher would be talking and I would raise my hand and be like, okay, but what about in children? What about in pregnant people? What about, and that was kind of the joke. So towards the end of the class, after a teacher had me for a while, they would just go, okay, and I know you're going to ask, Jen, but this is how it affects children. And this is how, and so, yeah, I kind of dug deep into that, and that opened the door into, I had been in practice for about 3 years and started teaching obstetrics and gynecology at the chiropractic college. And that further got me to dive into like really the pathology of everything, and teaching, because it's basically a medical program, it's a med class. And so having to teach that and really spend time learning about what that is, because as I got a little bit older, students were getting a little bit younger. And so then they would be like trying to challenge me in different ways. And so I was it was a really good way to learn all kinds of things. And I found that, at that time, I could talk to OBs or midwives or, different people and be like, hey, I'm trying to figure this out. What do you think about this? And, get some more information. What do you actually see in practice? What are you seeing, and really like, okay, this is what the stats are, but like in our area, what are we seeing? What are we, and really go from there. And then that kind of led into teaching for the International Chiropractic Pediatric Association. So that's the ICPA. If you're familiar with the Webster technique, I'm one of 3 chiropractors that teaches the Webster technique and certifies the other chiropractors. Yeah.
So cool. The really incredible breech turning technique, as well as pelvic balancing and all of that. So it's very well known by midwives, because a lot of times we're desperate to help those babies turn. So brilliant. Well, so let's go back to you, Sophia, because one of your inspirations to have this conversation on the air is because I feel like you discovered something in your care with Jen, with your NICU babies, that you wanted other midwives to know about so that they could share it with their families. Will you take us through the story of like what happened?
Yeah. And so I actually had a different chiropractor when I was pregnant with my babies, who had since moved out of town. And when I was pregnant, I found out I was pregnant in Hawaii, and I was like 3 weeks pregnant, probably on the table of this chiropractor in Hawaii. And she told me, she's like, are you trying to get pregnant? And I just started crying because I was, and she's like, oh, you're pregnant. And the adjustment that she did on me, I had been to a lot of chiropractors and it was just different. It felt so different. And I was like, is this a certain style, or like, where did you go to school? Like, do you know anyone who lives near me, And one of her schoolmates lived in the same town that I lived in, coincidentally. So I was like, oh my gosh, this is destiny. I have to go see this woman. And so I started seeing her. And then just because of schedule, I ended up lining up more on the schedule of her partner. And I remember feeling really resistant because I'm like, no, but I'm destined to see this chiro. But I was seeing this other chiropractor more often. Well, I'm kind of going to go a little bit wonky, not chronologically, because I didn't realize the extent of her health until my second child was born. So I had my first at home, and I'll explain that later. But my daughter came like a week too early, in air quotes, because I'm in California and our laws tell midwives that you can only support people at home from 37 to 42 weeks. And I was like 35 and 5 or something. So she told me, meet me at the hospital. I'll see you there. I had my first son at home in 6 hours. So I walked into the hospital actually really cocky. I wasn't scared at all. I was like, let me show you how this is done. I was kind of like excited to show them what like birth actually can look like. And the first thing they did was check me and found out my baby was breech and was like, great, time for a C-section. And I was like, no, thank you. And signed all their papers. But they just kept pushing harder and harder. And so I got in my head like, okay, I'm going to get this baby to turn head down. And then I could just have the baby and go home. And I did. I did some visualization. I did some spinning babies. And she did. She turned head down. But in the process of turning head down, her cord presented first. So at that point, I was like 8 centimeters, bulgy bag, full of umbilical cord. And so I just took some time, a couple hours with my butt in the air going like, okay, baby, if you're going to make a miracle work, do it now. I eventually opted for a C-section at that point. And shortly after she crashed, she was on breathing equipment, CPAP. She had machines breathing for her. They told me that there was nothing left they could do for her, that she was too unstable to even transport to, a higher level NICU. And even if she survived, she'd just be on oxygen the rest of her life at that point. And we had posted a picture of her x-ray on Facebook, just asking, letting our people know and send love, send prayers. And our chiropractor at the time saw it and she was like, I can see what's wrong. Will you please let me come and adjust her? And I was like, I was so nervous because anytime they touched her, she just got worse. And the doctors were just like hovering, but like not really doing anything. And my husband was like, we have nothing to lose. They already gave us the worst case scenario, but chiropractors don't have hospital privileges. So we decided that we were going to tell our team that we had a friend coming to pray for our baby and we wanted privacy and space. And she was on all the monitors. They could see her, her vitals, and they could come in if she needed anything, but that we just wanted time alone to be with our baby. So we closed the little curtain, and if you've never seen a baby be adjusted, it honestly doesn't look like they're doing much. No offense, Jen. But it looks like she just was kind of cradling the baby's head and maybe like vibrating her finger a little bit. I remember her saying that the pressure she uses on a baby was the weight of like a dime on the tip of your finger. It's just like very little pressure. It's not like the head cracking or anything that you might imagine. And she did whatever she did, and then she left. And 4 hours later, she was off everything and has never needed oxygen or any support. She later told us that the atlas at the base of her neck in the x-ray was completely off. So she just knew that everything running through there, if it's being pushed, it's just not functioning. And so that was what her focus was on. And we always made little jokes that the only thing she couldn't adjust was her attitude, because she is a fiery little girl. But that moment made me like flash back to my son's experience, because my son was born with Vactral Association, which is a whole acronym that stands for all the areas of the body that can have birth defects. And so he's had like 9 surgeries, 6 for the first year. But we were in the hospital for a month the first time. He had surgery. He crashed. He was on breathing machines. They didn't know what was wrong. They thought maybe a blood clot, but they called us up to just be with him, because they didn't know if he was going to make it. And the next day, my chiropractor had arrived to adjust me because I was having some back pain from labor. And she offered to adjust him. And we didn't really say anything. The people were kind of in and out, but she just kind of did her thing. And he got better. But it wasn't this like, we've given up on your baby. It didn't feel as dire, that experience. So it didn't stick with me that like that made the difference. I just felt like, oh, he was probably just about to get better. And I'm sure that didn't hurt, it was great. but it made me reflect when that happened to my daughter that potentially something similar happened with my son. And it just opened my eyes to what chiropractic can do for babies, especially if there's like a traumatic experience and just like the pressure on the head or like a shoulder dystocia, manipulation, just anything. I mean, we had a dystocia where the baby had no movement in their right arm. And my students joke that instead of me saying, call 911, I'm like, call the chiropractor, get her here, you know? And she came and baby had full range of movement, you know? So it's just things like that where normally maybe a baby would go to the NICU. And even if maybe they still go to the hospital, we're at least like, let's get the chiro here first so we know we can rule that piece out. And I don't know how any of the magic works. And that's why I invited Jen on so she could give the details of, you know, how, like what they actually are manipulating and how it's helping these babies.
Yeah, I love that. And thank you so much for the generous telling of your story. I know there's like a lot of layers there and a lot of emotions, and you've been through so much, and what a tremendous resource. Jen, talk us through, obviously the central nervous system controls everything. And so chiropractic is focused on that, of the alignment. So talk us through, like, what are you actually doing when you're adjusting those tiny, tiny newborns?
Because I don't think a lot of people know that it is about nerves. They think it's about bones and like.
Right. Okay. Yeah. Let's even start there. Yeah. Brilliant. Okay.
Yeah. So the idea of chiropractic is sort of predicated on the fact that the nervous system controls everything in the body. So that's every organ, every tissue, every cell, every muscle, everything. And so with babies, it is a little bit different. Like Sophia kind of mentioned, it's not, I have to correct the language because we don't do like manipulations on the baby, right? We're not manipulating babies. What we're doing is removing any kind of torsion or restriction in the movement of their body, and gently getting the brain to kind of come back online, if you will. So somebody, I think it was Sophia, talked about spinning babies. So spinning babies was developed by Gail Tooley, Gail Tooley was a student of Carol Phillips, who is my mentor. And we do something called dynamic body balancing, which is myofascial unwinding, kind of in conjunction with chiropractic, but really that's what most pediatric chiropractors do. And what I will say with that is, like, there's general chiropractors that go to chiropractic college. Everybody gets a doctorate, and, you know, but pediatric and prenatal chiropractic is really a specialty. If you're going to go to a chiropractor, make sure that they've done their training. The best one, and I'm biased, I work for them, is the International Chiropractic Pediatric Association. It's the oldest and longest kind of running pediatric prenatal group. But so what we're doing is we're looking at the whole body. We're looking at the system, and some of these torsion patterns, or this, like, the fascia is kind of the tissue that surrounds every organ, every tissue, everything in the whole body. And it's sort of like, if you go, sorry if anybody's a vegetarian, but like if you go to like take off the skin of a chicken and you separate it from the muscle, that white stuff in between that looks like kind of cobwebs, that's the fascia. And what they're finding now is that fascia actually has electrical conduit. It is an electrical conduit. So it actually brings and sends information much like nerves do. And so when there's restriction in the fascia, that's going to decrease information signals from going from one area to the other area. And so that is going to, so what we do is we find those distortion patterns and we gently kind of help the body to facilitate neurological change and allow the body to do what the body's going to do. So a lot of what chiropractic is for babies is sort of just finding the area that needs attention, holding it, and letting the baby wiggle and move and do their thing. And so that's kind of what we're doing. And these can happen, we see a lot of times we'll see babies like in my line of work, like I'll see babies with a hand up here. And the mom is like, oh, the hand always wants to be up there. And I'm like, do you have any ultrasound pictures? And we look at the ultrasound and sure enough, baby had a nuchal hand, or I'll ask, did anybody say anything about a nuchal hand? And we find those patterns, but how you are in utero is how you're going to be on the outside as well. And so if you're growing in kind of that less than ideal, not that luxury pelvis, then there can be distortion patterns where the baby has actually grown into that kind of pattern. I equate it to like if you've ever seen a tree and they build like a chain link fence right next to the tree, and over time the tree kind of grows around that chain link fence. We're all going to grow. And this isn't like, in Sophia's situation, perhaps it was life or death for Gracie, but for most people, you kind of grow and you're fine. And, you don't necessarily like, quote unquote, need chiropractic. And like, I hate that terminology because I'm like, everybody needs chiropractic, right? Like, I could argue that like, if we look at the tree, I'm going to make the argument, and 10 times out of 10, that fence being in the tree is not good for the tree, right? It's still a tree, it's still doing tree things, but if we can remove that obstruction and get the tree to be a better tree and function properly, and the same is true for this type of thing. So there are symptoms that we can think, but those are the babies that are bad enough to have problems that then people say, oh, the chiro should come, right? And it's like, what about all of the asymptomatic or the babies who are less symptomatic?
Yeah. The milder things that might not like ring red flags, but are like really could use attention as well. Gosh, it's so much to think about. Like, Sophia, when we were planning this episode, you were saying like, wouldn't it be amazing if there were just chiros visiting NICUs all the time? Yeah. Like, wouldn't that change the world?
I just got them to like report my story, and I was like, wouldn't this be amazing? And they were like, thank you for sharing your information with us. Your case is closed. I was like, okay. Like, I was trying to go farther with it. Like, wouldn't this be an amazing service? Like little things. My son wasn't able to latch or take a bottle. He was tube fed. His tongue was kind of like stuck to the roof of his mouth, just like someone explained it, like muscle memory. If he was like engaged. I remember like 23 weeks, he committed. He was not moving until he came out. He was down there. And they said that it kind of like forced his tongue to kind of grow, like you're saying, luxury pelvis, like towards the roof of his mouth. So he couldn't get it under anything. And I had Jen come and do some cranial sacral work. His tongue dropped. He latched right on, so little things like that, which maybe he just would have been tube fed, or maybe eventually he would have taken a bottle. But things like that, where I was like, I knew enough to be like, let's get these ladies out here and do some work on the baby. And then his tongue never went up again. It just stayed down.
The transformation is remarkable. Wow. It would be really amazing to imagine that world, wouldn't it? And there are so many midwives and birth centers who do work with chiropractors. It has become integrated in that space in a lot of ways. But yeah, thinking about it mainstream is kind of mind-blowing, isn't it?
And Jen, when I think when I had said manipulation, I think I was referring more to midwives in terms of like when you really have to help get a baby out.
Totally.
Because we did have a birth that was really difficult. Baby came, was fine in air quotes, but was just spacey. Like wouldn't really match. Was just kind of like, we were almost like, is something keeping them from blinking? Like, they're just kind of like spacey and not fully in their body, and almost looked a little distorted. Like one ear was kind of lower than the other. And I remember like a nipple was almost like in the armpit. It was just, he was wonky. And we called you, and you and your husband, middle of the night, came over, and I kicked myself for not taking a picture of him before, because he was within 10 minutes totally transformed and was like sucking on his hands and symmetrical. And I was like, this is a completely different child than 10 minutes ago, because we weren't sure we were going to go to the hospital. We're like, maybe there's something going on and he needs to be seen. But I was like, let's get the chiro out here. And we are blessed that, Acorn Chiropractic is more or less have been on call for our families, which has
That's amazing. Yeah. I've had a baby like that too. And, a couple times and maybe they came through the pelvis so fast, or maybe so slow, or maybe they were an OP presentation, or, all kinds of things can result in these kinds of stunned babies. And I've also seen that kind of that missymmetrical, especially those OP babies. They come out and you're like, oh, you're not okay. Your central nervous system has just been squished it, And I agree. I think there are quite a few babies in the home birth scene that get transported because they're not normal. We can't keep them because we can't say these guys are normal, but the hospital also doesn't have anything to do with them. They put them on oxygen or CPAP, or they put them on observation, or they put in an IV, or they do antibiotics just in case, or whatever kind of thing they throw at the problem. But it's not necessary. There's like nothing comes back on culture, or they can't say anything's wrong. They just eventually kind of rewire. They deal with their situation, because we're such adaptive species. But imagine how many of those kids could recover within minutes or hours instead of maybe a week in the NICU. And that's why I love the proposal that you have here.
This episode is brought to you by Lawdor Bookkeeping, a virtual bookkeeping firm supporting midwives and doulas. We understand that what you love to do is serve mamas. And sometimes nothing takes you out of your zone of genius like thinking about the money. But fortunately, there is a way to make confident money moves, pay yourself a consistent salary, proactively save for taxes, and plan for growth. This all starts with clean, tidy books. That's where we come in. To learn more about working with us, click the link in the show notes.
Let's move into real world application. And, most of the folks listening to us are practicing midwives. Jen, what works? How would a midwife or a birth center go about building the relationship that you have with Sophia's practice?
So chiropractors want to work with midwives. And I think that especially, I can speak for International Chiropractic Pediatric Association chiropractors. I like the ICPA chiropractors. They want to work with midwives. They want to work in that realm. And that's what they're sort of dedicating their continuing education to really do. So, there's pretty simple ways to do it as far as going to the ICPA website, icpa4kids.org. There's a Find a Chiropractor button, and you can click that and find chiropractors in your area that are Webster certified. One thing that is often confused, I think, in the world, and I'll say midwifery in general, is Webster doesn't necessarily equate to pediatric. So Webster is really focused on the mom. It's really focused on,
it's a prenatal process.
It's a prenatal process, right? And so really you're looking for somebody who has more than, I don't want to say just the Webster certification, because that's a really great certification, but more education than that. So a CACCP would be on the website, or a DACCP. As of right now, there are 69. I was the 69th DACCP in the world. So there are not very many DACCPs, but there are a lot of CACCPs, and that's certified through the Academy Council of Family Practice. And those are the chiropractors who have gone above and beyond to really focus their energy on pediatric care. And calling, the midwives can call and say, hey, I'm a midwife in the area. I'd like to grab coffee with Dr. whoever, and try to establish that relationship. For me, it's like, I can't, I would have loved a picture of the crooked nipple because it was so bizarre, but it's all about that fascial restriction. And it's like, if we can get babies, and you were talking about babies going to the NICU for a week, and it's like, well, but that whole golden hour is gone, right? That whole precious few days of having your newborn with you, helping the uterus go back to normal size, increasing that oxytocin, getting that prolactin going, all of that is robbed. And that stress, you cannot be in growth and defense at the same time. And so all of that stress is going to dump into that, and that it becomes imprinted on the baby. And so that comes, those are typically the babies that then develop into like colic. And we get babies in the office, and it's like, it's the same birth story. It's, traumatic birth turns into colic, turns into ear infections, turns into ADD. And it's just the whole trajectory of it. And it's like, if we could say, have your baby, birth your baby, and then, let's check your baby I prefer to adjust, to work on the baby on mom while she's breastfeeding, while baby is there. Is it clinically the most optimal position? No. I mean, I would make the argument that it's sort of similar to a woman giving birth in lithotomy. For you, it's an easier position, right? But for her, it's not the best ideal position. Same with that. Like when I'm working on a baby, if I could just have the baby, that would be better, but I'm going to make it work, and I'm going to put my body into weird contorted positions and figure out what's going on with the body, because I think baby needs to be on mom. It's hard when I go to births or shortly thereafter, and I see like everybody else is holding the baby and mom is just like, sitting there, and I'm like, get your baby on your mom.
It's
like
the baby's natural home,
Right, exactly.
And we talk a lot about the cascade of interventions of birth, but like same for the NICU, you could go for this one simple thing, but then blah, blah, blah. Now your baby has jaundice and blah, blah, blah. Now this, and now your NICU baby jail time. And you're just trying to get over these humps and over these humps. And you're there for like, 17 days when you're like, we were fine after 7. We could have gone home, but you keep having to like graduate these next steps and gain a certain amount. And, so then you're trapped there so much longer than you thought you were going to be.
Yeah. And it's like,
it's so frustrating.
Yeah. And looking at like, I'm thankful to have a NICU. I mean, modern medicine is why Ben is alive, like, yay.
Yeah.
The flip side to that is the overutilization is really depriving families of that connection. And I think that connection at birth, I mean, birth matters. I probably don't have to sell you on that. How people are brought into the world and how they're like told their birth story matters. And I think that it really sets out the trajectory of the rest of their life. And, it's funny because when I was teaching at the chiropractic college, I would kind of, I was a big proponent of home birth, right? And I would be talking about, home birth and how it can be. And, and somebody would come up to me and they're like, I was born C-section and I'm fine. And I'm like, okay. Like,
Thanks for the case study.
Exactly. I'm like, okay. And it's just, and not that everybody born C-section is trash. I mean, that's not what I'm saying, but like, there can be such a beauty in birth, and there can be, I think we just as a society need to have more reverence for birth. And if we had somebody there that's not a medical doctor, that's, but that's working on the baby and looking at, helping from the very beginning, because if a baby comes through the birth canal, I mean, my second son was OP. He came out all wonkadoodle and we got to work on him right away. But it's like, if we can be working on the baby right away and getting the baby latched to the breast, then it's going to help the whole thing. It helps the whole situation, and it will help with the bonding, and it will help with everybody's experience in the postpartum recovery period.
I just have to say too, Jen, the way you have set up your chiropractic club is very different because it is a membership. And I don't think many chiropractors are doing that. And the thing is that is why families can come every week and have the whole family be seen, is because they don't have to pick only who is suffering the most and see them until they're better enough, because it's so expensive, like, because sometimes you're faced with a situation where they're like, chiropractors like, you really need to come in like 3 times a week. And someone's like, can't afford that. But the way Jen's program is set up is it's just a flat rate fee for a month, and you just come as many times as you need. So if you need to be
Amazing.
and I think that really does make a difference for our families. You know, there are a lot of chiropractors in our area, and sometimes, like, especially during pregnancy, when you maybe want to be seen more frequently, finances, it would be nice if it didn't matter, but it does. And so our families can afford to have the care that they want.
Yeah. Gosh, Jen, that's a whole nother podcast. Business structure and everything. That's awesome. And it's, I mean, just real talk, it's working for you financially.
Yeah. I mean, we have 3 locations, 17 chiropractors. I think, I mean, it works real well.
It's such a great model because it centers the community.
Yeah.
Instead of the provider. And that's, of course, something we're pretty passionate about at Community-Based Midwifery. So I'm a super fan. I've discussed this with midwives before about how to build kind of a co-op kind of a model for midwives, how we can build a membership kind of a plan for midwives. And that's an interesting leap as well. But chiropractor seems a lot more likely, like a lot easier to implement because the scope of care is so much more individual compared to
He's got to go to places that have lots of babies.
It could work. Exactly. I've been thinking a lot about how, if you have 2 babies with me, get your third half off,
right?
How can we make that happen?
Yeah, but it's with the hospitals because, you know, like, even if they know it works, it's just policy slow to change. I mean, our pediatrician had come in at one point in the NICU and was like, did you have a chiropractor come and adjust the baby? And a nurse must have heard me say something. I was trying to be really quiet because I didn't want to get her in trouble. I'm like, no, like, she came and adjusted me, but like not the baby. And he's like, do you mind if I talk to her? And I was like, sure. And so I gave him her number and I texted her like, he's calling you. But she's like, that's fine. And she said that he called and he asked if she had adjusted the baby, and she said no. And he said, if you were going to have adjusted her, what would you have done? And she was like, I just got the sense that he knew. And he was like, look, I'm not trying to get you in trouble, but this baby wasn't going to live and she's fine now. Like, I need to know what happened. And so she's like, well, if I had done anything, I would have blah, 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 you know, and kind of explain the whole thing. And she was saying how it would be such a great, you know, option for NICUs to have chiropractors. And he just kind of maybe mumbled something like, you know, hospital policy slow to change. And that was kind of the end of it. But so, you know, she was like, I got the sense that he was like, this is one of those babies that wasn't going to live and nothing's wrong with her now. I need to know what happened. And we were probably not going to make changes. Like, how can things like live together in this world?
Yeah.
You know? That shift. And I'm sure he's had experiences of babies that didn't live, and like feeling like somebody is nearby that can make a difference. Like, it blows my mind. I don't understand.
Yeah. Blows my mind. Oof. Yep. But then again, I mean, in the doctor's defense, they're not the policymakers. And so this is the benefit of these small entrepreneurially run clinics or birth centers, is that we are the decision makers. We can set policy, and that's why it's being implemented already with midwives. But it's a natural partnership for sure. And I love that you have a whole team. So maybe it's not always you, Jen, going out in the middle of the night.
It's pretty much me.
It's pretty much you. Yeah.
So
there are a few that are willing to be on call
while you're on maternity leave. So
you have, I know. I'm like, I miss Sophia. I don't have you anymore after my appointment, after my 6 weeks, and now you're not calling me to go to birth. I'm like, what the heck?
Well, it's good to sleep if you can when you're a new mom. So there's some gift there. Well, it's awesome. And I'm really impressed with what you two have both built in your community. What a resource. I bet you just get overwhelmed with the gratitude that flows your way, both of you. So.
Yeah, it's just a blessing. It just feels like I have a secret weapon in my back pocket if we need anything, you know, so we feel really loved. It's not a situation where we're like, I know someone who could help, and they're open 9 to 5, so we're going to either decide to go to the hospital or wait till they open. Like, there's somebody who is available if we need them in a pinch. And we hope we don't have to call, but, we hope it can wait the next office day. But
yeah, but if it doesn't, Jen, or did you or any of your team regularly adjust moms in labor? Have you added that service at all?
Oh, yeah.
Yeah. That's the most common application, I feel like, of chiropractors in the birth scene.
Yeah.
Is, prenatal care, of course, but then being called in labor, being like, we have a dysfunctional labor, we have a malpositioned baby, we have external pain, abnormal pain, and tremendous results from that.
Yeah. And that's honestly how I started checking the babies, because I would go to the labor.
You were there.
And then when I got there, and a lot of times, like, no offense to our dads, but like sometimes they're sort of useless in labor. And so, I would get there and then I would work on them. And then the mom would say, please don't leave me. Please don't leave me. I'm like, I'm not going to leave you. If you ask me to stay, like, yeah, okay, I will quit the rest of my day to stay here. Like, what an honor. And so then I would stay, and then they would, baby would be born, and they'd be like, well, will you check the baby? And so I was checking babies, right away. And that kind of was awesome, because it was totally awesome, but I got to see babies right away that were not even necessarily didn't have something wrong with them. That gave me a lot of experience to then, when I am called for, the goal is to get mom balanced so that she goes into labor, has a baby, and it's like not an exciting labor,
baby stays balanced.
Exactly.
But you can see the correlation between dysfunctional labor and funky baby reality. Yeah, I've seen that as well. It's a very cool correlation. And it can, it really convinces you of this model of actually the torsion, the torque, the twists that baby makes as they spiral through the pelvis in that restricted pelvic space can really restrict then baby, right? So this is that optimal, luxury pelvis. Then makes
Jen shared about what the baby is doing when they cry, and how you can describe it better, but how it helps push their head back into shape, that it's all these natural things that they do, it's for a purpose, and because a lot of times they're shushing, it's no, they're actually doing what they need to be doing to put themselves
and communicating.
And that's really the way that I look at it is there is no random behavior. Babies have no random behavior. When a baby is crying, it's serving a purpose. So what Sophia is talking about is, if a baby is born and their head is overlapped or underlapped, the plates are overlapped or underlapped, often those are going to be babies that cry more. And I look at it as what they're trying to do is increase that cerebral spinal fluid flow to actually help be able to pop out their cranium. Now we can help with that and help guide that along so it can kind of occur better, because nobody wants a screaming baby. But when you look at it as there is no random activity that babies do. They don't expend resources for random behaviors. Everything means something. Everything that a baby does is a window into the nervous system, is a window into their whole body and their whole being. And so when you really kind of come from that perspective, I think that it also changes what you're looking at, because it's not just oh, well, that's funny, that baby just does that. It's why does that baby do that? What is that baby telling us? They're communicating with us. And I think that that's when you kind of switch that, you're able to see it from a different perspective. And I think that sets babies up better.
Yeah. And when you start with chiropractic care with babies, it opens up your eyes to all the things that chiropractic can support, ear infections, bedwetting, just not just oh, I have a bad back, or I, hit my head, or, something like that. But, my son had an ear infection, and, the first thing we do is have the chiro come adjust, and his temp goes up and then it comes down and he heals. And it's just like, yeah, it just opens up your world to how supportive chiropractic can be outside of just like my back hurts, you know?
Right. Because again, it's not about the bones.
Right.
It's about the central nervous system and how that impacts everything.
Yeah.
And
it's
so
for everything.
Yeah.
Just go see the chiropractor first and then we'll see what else you need to do.
Yeah, I love that. What an important model that you guys are reminding us of. And I just want to drive the point home that, like you said, Jen, chiropractors want to work with midwives, especially ones who've gone and gotten the extra training in pediatric and perinatal care. They actually want access to that population.
Yeah.
And you guys could be a really beautiful, mutually referable community, referring back and forth. It's like a symbiotic unit, actually. And so if you are not connected with a pre and perinatal chiropractor space yet, like you said, just reach out. Hey, I want to have coffee. I want to take you out to lunch. Let's talk about how we could serve this community. And begin where you are with the mutual referrals, and then invite them into birth, invite them into the space where they can really do the most benefit, the most change. And those newborn babies, as Sophia experienced with her babies, is just like extraordinary transformations. And I think it's like what you were saying, Jen, is it's not like some magic thing. There are advanced trainings for this, and there are chiropractors that have the skill, right? It's not one magic person. It's an actual system that can be applied.
Right. Yeah.
Which is that's all just good news. It's just
all the stories like low oxygen levels, functional breathing, just all these things. It's just like sometimes it's 5 minutes of hands that know what they're doing and you stay home. It makes the difference, for that.
Wow. Or in your case, you go home from the NICU, which is also,
Yeah.
Well, thank you both so much. What a wonderful topic. Thank you, Jen, for joining us. Sophia, for suggesting this topic. And I hope it's really meaningful to our community of midwives. How can people get in touch if they want to know more?
Our business is called Born Wild Midwifery, and it's just bornwildmidwifery.com and same social media accounts. And we also have a podcast, Born Wild Podcast.
Okay, we'll put that in the links. And Dr. Jen?
Personally, probably Instagram, Jen Santos DC.
Okay, got it. We'll put those in the show notes just in case people want to reach out, because you're both doing extraordinary things. Thank you so much for being on today's podcast. It was an honor.
Absolutely. Thank you.
Bye, guys.